right, well, I think we can go ahead and get started tonight. Thank you, everybody, so much for being here. We're really happy to have you. I am going to introduce our introducer tonight. So we're lucky to have Gary Hirschberg introducing Dr. Willett tonight, and then he will also be moderating the Q&A after the presentation. He is the co-founder and former CEO of Stonyfield Organic. And Gary, I will pass it over to you.
All right. Well, thank you. And thanks to all of you for joining us. And Bob and Emily, thank you for having me. Look, we're here to hear from someone very special. And so I'll just keep this terribly brief. You've seen Walter's bio. I probably don't have to read it in detail, but he's both the physician, epidemiologist, and of course, a professor of epidemiology and nutrition at Harvard School of Public Health. Walter and I have been acquainted for a long time. I joke, Walter, that I can't remember what year anymore. I just try to remember what decade things happened in. You can probably relate, but it's been decades. And I should say too, that as somebody who built a business and a career at the nexus of nutrition and environment, and particularly climate science, I'm a particular fan of our speaker tonight. You really can't go very deeply into any aspect of nutrition without encountering Walter's name, his work, his reputation, and frankly, his accomplishments. So, I mean, over 2,000 research papers, mainly on lifestyle risk factors for heart disease and cancer. But of course, you know, in the world of cancer, there's the treatment world and there's the prevention world. And we all know the most effective way to deal with cancer is to not get it in the first place. And Walter has been truly a hero in guiding, I think it's fair to say, millions. I'm sure you'll be more humble than that, but to make the right kinds of choices. So tonight, we're obviously going to talk about the sort of the whole question of sustainability and obviously healthy food, as we say at Stonyfield, healthy food, healthy people, healthy bodies, and healthy planet. So very eager to hear from Walter. We will, when Walter's completed, we will then go to a Q&A. And I think that what we agreed, Emily, the best way to do that is if you all want to use the chat to send us your questions, I'll be kind of logging them while listening to Walter, and then that'll be the easier way with this many people online to try to get to as many questions of your questions as possible. So Walter, the floor is yours.
Well, thank you, Gary. And let me look for my screen here. Oops, where did that go? I had it here just a minute ago. You have to give me a minute, it disappeared.
2 years into Zoom, we're just all
right.
starting to.
Yes. Sorry about that. I had it a minute ago and it escaped me.
No problem.
Okay, can you see that now?
We're not, no, you're not sharing yet.
Okay.
Emily, does Walter have sharing privileges? Because sometimes that's the problem.
He does. Yes, he should.
Okay.
And if you're not able to, just let me know and I can pull them up.
Okay, something went wrong here.
Well, if you've got them, Emily, Walter could just tell you to advance.
Just a second here. I should be able to pull it up again. I just have to go back a few steps.
No worries.
At least we didn't have to begin tonight by telling you you're on mute.
Okay. I think, Emily, you better pull them up here. It doesn't want to come up.
Yep, sounds good.
Great.
That's why we have under 30-year-olds leading us.
Right. Great. And let's see, can you go to full screen on that? And basically, I will thank you, first of all, Gary, for the introduction, and thanks to everybody joining us this evening, because it this is such an important topic. I really appreciate so many people coming out on what at least here is a beautiful spring evening. I'm going to talk about the huge issue of, can we feed the world a diet that is healthful and sustainable at the same time? Next, please. This talk will borrow quite a bit from a report, the commission that I co-chaired with Johan Rockström from the Swedish Resilience Center. This was the Eat Lancet Commission. It was funded by the Wellcome Trust, which was very important because it did allow us to bring together 35 scientists from 17 different countries around the world. And we really needed that range of expertise and also perspectives from Asia, Latin America, and Africa. Next slide, please. The challenge we were given was, how can we feed what will be about 9.8 billion people in 2050 a diet that is both healthy and sustainable? Next slide. That sounds like a simple challenge, but in fact, it's huge. That even today, we're not feeding the roughly 7.5 billion people we have a diet that's healthy or sustainable. On the nutrition side, we still have several billion people lacking key micronutrients. We have tens of millions of children who are still stunted, and we have now more than 2 billion adults who are overweight or obese. Next slide, please. Now, probably the most conspicuous evidence of the nutritional problems we face in America and in many countries around the world is the obesity epidemic. This shows the trend upwards in prevalence of obesity in adults starting at year 2000, and it's gone up very steadily and unrelentingly. And now we have about 42% prevalence of obesity, and that was up to pre-pandemic years. The national surveys stopped during the pandemic, so we don't have the most up-to-date data. But from all the indicators we're getting, that 42% has jumped quite a bit during the last couple of years. And to put this into perspective, if we look back at 1970, when I started working in this area, the prevalence of obesity was only about 10%. So this has gone up about fourfold over that time. Next slide, please. And it's not a uniquely American phenomena. At the top are the affluent countries, and they're almost all countries, with a few exceptions I'll note, are increasing in their prevalence of obesity. And even the low and middle income countries at the bottom there are going up, in fact, at an even sharper rate than in the affluent countries. So the whole world, with again a few exceptions, is experiencing this pandemic that's more subtle than the Omicron, but perhaps more serious. Next, please. And of course, it's also important to point out that just average numbers or total prevalence doesn't paint the full picture. There are huge issues and disparities. This is looking at life expectancy, for example. The Latino population actually has a better life expectancy than the European American population, probably mostly because of recent immigration and continuation of some positive traditional behaviors. The African American population at the bottom has a substantially lower life expectancy, and up to the pandemic years, we were closing that gap. But on the right, those dashed lines there show what's happened during the pandemic, that the African American population has lost about 3 years of expected life. The overall and European American about 1 year, and Latino population about 5 years. So the impact of the pandemic has been hugely different in different groups within the United States. But overall, as you can see, all groups were actually declining in life expectancy before the pandemic hit. And that, of course, it has been unprecedented if we go back over the last few hundred years, last 100 or so years where we have data. Next, please. This shows different countries around the world. And if you look on the left there, you can see US men at the bottom there, declining in life expectancy. A couple of the other countries have stagnated. But again, it's really important to realize that this is not inevitable. Not all countries are going downward in terms of life expectancy. Japan has been at the top, just steadily going up. At the right, as for women, and again, you can see declines during the most recent years. and Japan, but also some European countries, France and Italy, looking pretty good in terms of steadily increasing life expectancy. Next slide, please. A lot of this probably does have to do with the obesity epidemic. As you can see at the top, this is body mass index average for the population. Again, this is sort of American exceptionalism at its worst here, that we're really topping the pack here in terms of BMI, just going steadily up. And at the bottom, Japan, if you look over on the right, it's really remarkable among women. The BMI has remained below 5%, actually drifting down a little bit, whereas it's up to, the prevalence of obesity is under 5%. This is looking at average BMI, and still, again, up at about 42%. But it's not just Japan. If you look again at the right side there, Italy and France actually have had some declines, slight declines, certainly not going up over the last decade in terms of their BMI. So it's not inevitable that we're experiencing this steadily upward trend. Next slide. So we are starting to see the consequences of the poor state of nutrition in America. And I think we've entered a period where we're actually going down in what might be called a death spiral. On the environmental side, the situation is actually even more worrisome. And I say that as somebody who's focused on health for the most of my career. But we've known for quite a while that climate change has been happening, temperatures are going up. But I think just 20 or 30 years ago, most of us thought that would be experienced, the consequences would be in 500 or 1,000 years. But what's really worrisome here is that this is accelerating. It's not a linear increase. And all of the warmest years around the world, here are 4 different measures, show the warmest years have all been within the last decade. Next slide, please. And some of this is really getting into, again, a vicious circle where as temperatures go up, permafrost melts, Arctic ice cap melts in the summer, that releases more methane, that speeds up climate change, so that speeds up the temperature, and we're going around and around in a circle that is getting very close to being irreversible. And that's why you've heard all the warnings from United Nations groups over the last couple of years. So given that background, the challenge we were facing as a commission was pretty major. After thinking about how to tackle this, we broke it down into 4 steps. First of all, define a healthy reference diet, that everyone would agree we should eat healthy diets, but when you actually come to putting numbers on it, what does that really mean quantitatively? That's not always so straightforward. So we used many different kinds of studies, really looking at the whole world literature. We used controlled feeding studies that are randomized, long-term cohort studies, and very few randomized trials that were available. Our colleagues in the earth sciences had been developing what they call planetary boundaries for key environmental systems. That, for example, includes greenhouse gas emissions. We know we can't go to 0 greenhouse gas emissions from food production systems, that there is some inevitable greenhouse gas release, but there are limits at what could be produced from the food system and still be sustainable. Also, we looked at cropland use, water use, nitrogen and phosphorus, fertilizer application, and extinction rates. And then we used a global food systems modeling framework to see what combinations of changes in diet, food reductions in food waste, and agricultural improvements might enable us to stay within the planetary boundaries while still delivering healthy diets by 2050. And we use that 2050 as a goalpost. Then we looked at strategies that might be needed to take us to where we needed to go. Next slide. I'm going to walk through the kind of evidence we looked at, focusing on major protein sources, because the choices among protein sources are particularly important for both environmental impacts and for health. So this is looking just at the PS ratio, the ratio of polyunsaturated to saturated fat in foods. And we've known for decades that higher PS ratio will reduce LDL cholesterol. And we know, of course, that LDL cholesterol is a major risk factor for heart disease. So PS ratio is something we've used for a long time to look at quality of foods or quality of diets. And we know that beef has a lot of saturated fat, but it also has very low polyunsaturated fat. And so it has a very low PS ratio. Chicken actually has quite a bit more polyunsaturated fat. Salmon has more, but if we really want to go to high PS ratios, we need to look primarily at plant sources of protein, such as nuts, soy products, and lentils. So that would predict that those foods, based on their effects on their composition for a type of fatty acid, would be more beneficial than eating beef, for example. Next slide. But that was just looking at composition. There are also dozens of randomized trials that have looked at different foods and their effect over a few weeks on risk factors for cardiovascular disease. And so some colleagues in Potsdam, Germany did what they call a network meta-analysis, combining 66 randomized trials of different food groups, looking at their effects on blood lipids, measures of glucose homeostasis, blood pressure, and inflammatory factors such as C-reactive protein. And then from their effects on all of these risk factors, they created a risk score with higher being better. And so nuts came out at the top, not surprising from what I showed you. Legumes next, whole grains next, fish, quite good. Fruits and vegetables, very good, refined, but then refined grains, not so good. Red meat, eggs, poultry, dairy, and sugar-sweetened beverages at the bottom, which line up quite well with what I showed you earlier in terms of composition. Next slide, please. Of course, what we really are interested in is preventing the clinical manifestations of the food we eat. That's what we really experience. That's what we're really trying to prevent. So our group has set up several large cohort studies to look at this question, along with many other questions as well. The first study was the nurses' health study, and maybe a few of you registered nurses are maybe in our group tonight. But this has been a very major national study. We enrolled about 121,000 nurses back in 1976, initially mainly to look at long-term effects of all contraceptives. But I was interested in diet, and so we developed some standardized questionnaires to assess diet, tested them out, and administered those in 1980 among this group of women. So about 95,000 women returned those questionnaires, and then we've repeatedly assessed diet now every 4 years. And along the way, we're also, of course, asking about other factors that might influence health outcomes, such as smoking, physical activity, medication use, family history of disease, pretty much everything you could think of that might influence risk of disease we have collected in our data. We've also collected blood samples, urine samples. We can look at DNA, hormones in blood, and almost everything you might imagine. That was women. So we enrolled 52,000 men who were mostly dentists and veterinarians starting in 1986. Again, same design, and also another 116,000 women who were registered nurses in 1989, looking at the next generation, because a lot of our evidence was suggesting that what we eat and how we live during adolescence and early adult life is even more important than what we might do at age 50 or 60 when most studies begin. And I do want to point out that this work has been that of many people. I've listed a number of my colleagues here, and these and many more people have really made this study possible, but most of all the participants. Next slide, please. So this is what we saw looking at different sources of protein in relation to total mortality. Here we've combined the cohorts of men and women, so we have about 130,000 participants who are healthy at baseline. And then we're tracking diets over time because people do change what they eat and the food supply is changing, and keeping track of who died. So over 30,000 had died during this period. So we had a lot of numbers to look quite in a lot of detail at their diets in relation to mortality. And of course, in all of these analyses, we've adjusted for these other factors like smoking and physical activity. And here the comparison is dairy. When you're looking at something in the diet and say what is an increase good or bad for you, you always need to say compared to what. What's the comparison? And that comparison, of course, makes a big difference. So here at the far right, processed meat was associated with highest mortality, then eggs, unprocessed meat, fish about the same, and poultry about the same as dairy. But if we really wanted to go to low risk of mortality, it would emphasize plant protein sources, which is consistent with both the composition of those foods and also their effects on cardiovascular risk factors. So when we combine that kind of evidence, looking at randomized trials with risk factors as an outcome, and then long-term cohort studies that follow people for decades, and we have consistent information, that gives us a lot of confidence that these do really represent cause and effect relationships. Next slide, please. But the issue isn't just as, say, red meat, not so good for us, or neutral. The question really is how much. And so this is looking at that question. Here we see increasing servings of red meat per day, and in relation to risk of type 2 diabetes. We use type 2 diabetes because we had large numbers, over 13,000 participants had developed type 2 diabetes. And it's type 2 diabetes is very directly related to what we eat. For say heart attacks, there's other factors that are quite important, and also having a heart attack really represents what you've been eating almost from day one. So the relationship between intake and risk is actually much tighter for diabetes, and gives us a sharper look. And as you can see, even going from the first quintile to the second quintile on the left, there's a small but significant increase in risk of type 2 diabetes. And so we didn't want to recommend even what would be a small excess risk with red meat consumption. So we somewhat arbitrarily picked the midpoint between the lowest intake and the next level of intake. And that corresponds to about 1 serving of red meat per week. That is not an absolutely precise number. Maybe it's 1 serving every 5 days or every 10 days, but it's somewhere in that ballpark of quite low intake would be related to very low risk. Maybe not 0, but quite low. Next slide, please. So we've gone through this kind of look at the literature for each of the major food groups and come up with what we've called our reference intakes, or our target numbers for daily intake. Up at the top, grains are going to be, for most diets, an important part. And there's quite a bit of possible ranges that are compatible with good health. For example, you don't have to have grains. They're not essential. And you could have up to 60% of energy from grains. But what's really important is that they be whole grains, not refined grains primarily. Potatoes and starchy vegetables have a less healthy profile than whole grains, so we kept that amount fairly small. Fruits and vegetables are, of course, have many positive health benefits, and that amounts to about 5 servings of fruits and vegetables per day. Dairy foods are very complicated and interesting, and we don't have to have dairy foods, but the evidence does suggest we could have up to about 2 servings a day that could be healthy. It does look like yogurt is somewhat more healthy, probably, than other sources of dairy foods. But when we looked at the environmental footprints, and looked at this globally, we found that if everybody had 2 servings a day, that would not allow us to stay within greenhouse gas boundaries. So we kept it at about 1 serving a day. It's about 250 grams per day, is about 1 glass of milk or cheese equivalents. For red meat, we can look at the next slide, please. As I mentioned, that's about 1 serving per week. Poultry, next slide, please. About 2 servings a week. Better nutrition profile. Eggs, about 2 per week. Fish, next please, about 2 per week. Next please, with plant protein sources being the major sources of protein for reasons that I described. And then next please, and added fats will almost inevitably be a part of most people's diets, and there's quite a bit of potential for flexibility as long as they're mostly unsaturated fat. So we can trade off calories between whole grains and added unsaturated plant oils. And it doesn't make much difference over quite a wide range in terms of health outcomes. But the numbers we used here is a sort of a mid-range of about 35% of energy from total fat, again, most of it being healthy plant oils. And then added sugar at the bottom, that's about 5% of energy, which if you have 1 12-ounce soda per day, you're already over that 5%. So that's keeping added sugar pretty low. It doesn't have to be 0, but keeping it low. Next slide, please. So that's a lot of numbers pretty quickly, but after going through all this, I realized it comes out to be something pretty simple, and we do need to have simple messages. And this is 1 + 1, which most people can remember that. And that is meaning about 1 serving of dairy a day, again, preferably some of that being, a good bit of that being yogurt, and then 1 other serving of animal source protein per day, which would be some combination of red meat about once a week, some eggs, some poultry, some fish, and maybe another serving of dairy if we want that. This has been called a flexitarian diet or a plant-forward diet by some people because there's flexibility, about a lot of flexibility. If you want to be a vegan, that would be an option. But if you want to have some animal source proteins, this modest level would also be compatible with good health. And that's on, of course, a base of nuts, soybeans, fruit, vegetables, whole grains, and plant oils. Next slide, please. One question some Americans would say is that's so extreme. Is this possible? In fact, this is really consistent with many traditional diets around the world. For example, the traditional Mediterranean diet from the 1960s, when Greek men were the healthiest people in the world, Greek men were consuming about 35 grams a day from red meat plus poultry. Our numbers that I just went through come out to be about 43 grams per day. So this is very consistent with a traditional Mediterranean diet. Next slide, please. But it's also, again, consistent with traditional diets from many parts of the world. This is, for example, a Vietnamese meal where vegetables are a very major part of the diet. I was there a couple of years ago, just before the pandemic, and I'd never seen so many vegetables on a menu as I did in Vietnam, and just incredible variety, great flavors. With some fruits, some vegetables, nuts there almost at every meal as well, interestingly, peanuts mostly. And if you want to have some fish or have some other modest amount of animal source protein, that's fine as well. Next slide, please. Yeah. So where do we stand if we look around the world compared to what are people actually eating compared to those target numbers? Up at the top, looking at red meat, the different colors are different regions of the world. Gold there is US, we're way over that number of about 1 serving per week. But sub-Saharan Africa is right about at that number, and Southeast Asia is about half that number. So we can't say just increase or decrease. It really does depend on where you're starting. But for starchy vegetables, Africa on average is way over the target number because of a lot of cassava and yams there that are consumed for poverty reasons in huge amounts. And that diets are often unbalanced with too much of those foods and not enough of other health promoting foods. A lot of variability around eggs, poultry, dairy foods, but most countries could increase their dairy food consumption a bit and still be within the planetary boundaries or our target numbers. But almost all countries are short on vegetables, fruits, legumes, whole grains, and nuts. So if everybody shifted, it would be a combination of some countries going down in some groups, but almost all countries going up in health promoting foods. Next slide, please. So we looked at using 3 different models, what would be the health impacts of the whole world shifting to those target numbers that I described. We used 3 different models, and they all came up with pretty similar answers that this would prevent about 11 million premature deaths per year, which is about a 19% to 24% lower total mortality rate if we look at this among adults globally. Next slide. So huge potential health benefit. Then we looked at the environmental side of the picture, and this is a summary, a meta-analysis of many different life cycle analyses that have looked at the environmental impacts of different food groups. And red meat over on the left is highest. I think most people are aware of that. But this is about 140 times per serving greenhouse gas emissions compared to soy or legumes on the right side. Pork, chicken, fish, dairy, eggs, quite a bit lower than red meat. But those are still 30 to 40 times the amount of greenhouse gas emissions compared to plant sources of protein. Now there are bars or error bars around those dots there, which means there's variability from one study to another study. But most of those confidence intervals are actually fairly tight, except for fish, interestingly, and that depends enormously on how the fish is produced. And that means that's something to look at in more detail. Next slide, please.
Sorry, before you go on, Emily, I have to interrupt you because I had, of course, got a chance to preview these slides, and this one was one I wanted to stop you on. And I think you just answered it, but I think most people would be very surprised to see fish north of pork and chicken. And you just said it depends on how it's produced. So what you're saying implicitly, I think, is if it's farmed with a lot of grain inputs, that would bring the curve up. And if it's wild, it would bring it down. Is that effectively what we're seeing here?
Well, it's quite a bit more complicated than that. The worst is actually chasing swordfish around the North Atlantic.
Okay.
You burn a lot of gasoline doing that.
Okay.
And then some kinds of farming, as you say, that especially if they use running water where they have pumps going a lot. And also actually feeding grain to salmon is pretty remarkably efficient because they get they can get like a 2 to 3 fold ratio of what you feed them to what you actually eat. So that's not the worst. It's not the best. It's somewhere sort of in the middle.
Okay.
But on the other hand, yeah, some types of farming are like I've been to China where farmers will have a pond in their backyard and they'll have an outhouse on a little dock going out over the pond. That's sort of direct recycling, you might say. And so it's super efficient. But one thing that's pretty interesting is about the best is actually bivalves and mussels. And a lot of those are raised off the shore of New England, now farmed, but there's almost no inputs because they're filtering their diet from the ocean, actually cleaning up the ocean a little bit, and that can be done with very low input. So,
and I might add before letting you, caged aquaculture does the same thing, taking advantage of regular nutrient flows and waste removals. But anyhow, I don't want to interrupt you further. Thank you.
Yeah, well, thanks for raising that because this is, I think it's important where we see a lot of variability. It means we need to study this further and find out what the best practices are, because it looks like you can do this very well. And I also want to come back to and I think we'll come back to some of these issues around other animal source protein and carbon fixation. There may be some counterbalances and offsets here that I know, Gary, you're really interested in. We're not just interested in, you're doing. So we'll go on to the next slide, please. We basically incorporated that information on footprints for greenhouse gas emissions and other kinds of environmental impacts. And I'm just going to focus here on greenhouse gas emissions because I think that, for reasons I talked about, has an extreme urgency to it. So this is what our analyses showed. The planetary limits for the food system in terms of greenhouse gas emissions defined by the Intergovernmental Panel on Climate Change, the UN organization, concluded that we could emit about 5 gigatons per year from the global food system. That number is sort of hard to get your head around, but it's a big number. But by 2010, we were already a little bit over that number. And if we continue on our current track, where we will add another 2.5 billion people, and those people will continue to eat more of animal source products, we'll be at 9.8 gigatons per year. Somehow the PowerPoint's a little bit off there. We'll be way over the planetary boundaries if we continue on our current track. But if we adopted the dietary targets that I described, that would keep us at 5 gigatons per year, so right about at the limits. And if we improve food production methods, we could get that down to about 4.4, and a waste reduction even get it down further. But the biggest bang looks like it is from greenhouse gas. To reduce greenhouse gas emissions does involve a shift in diet. But we need to do all of these, we concluded, if we want to stay within planetary boundaries for land use, water use, fertilizer use, extinction. In other words, we need to shift diets, improve food production, and reduce waste quite substantially. Next slide, please. So this is just looking at the similar kind of analysis. I won't go through the numbers, but making the point again that we need to do all these three things: shift diets, reduce waste, and improve agriculture production methods. Next slide, please. This slide's a little complicated, and I had to spend a while trying to understand this, but it actually is important because this is sort of the path to human survival, you might say. And this is, again, put together by the United Nations panel on climate change and how we can keep it at less than 2 degrees increase centigrade. And various colorful lines there up at the top. This is greenhouse gas emissions from energy, next from industry, then buildings, transportation, and the gold section there, that bar, is from the food sector. Now that looks like it's quite small. Some of that is small relative to these other groups, but by their accounting system, energy inputs and transportation are put in those other sectors. So the real number from the food sector is probably more like 8 gigatons per year if we include those other inputs to producing food. And as you see in the line I've drawn there horizontally, if we proceed on our business as usual path, we'll be up by about 9.8 gigatons per year by 2050. So even if we eliminate all fossil fuel use, we'll still be above what is needed to stay with under 2 degrees centigrade. So the first priority actually is, and I do want to emphasize that, changing our food system isn't going to be enough. The first priority has to be getting us off of fossil fuels. And of course, we use a lot of those in the food system, but we need to look at how we heat our homes, how we travel, and virtually every aspect of our life, and at the same time shift our food patterns. And I also wanted to show and mention that green area at the bottom that says reaching negative emissions, and this it represents carbon sequestration, and the expectation is that most of that does come from the food system. In other words, capturing carbon in soil, and forestry is included there, so growing more trees. And that we don't actually have a very good global plan for that. I think this is an area that needs a lot more research. We don't talk about it as much, and sort of if that doesn't happen, then again, we don't stay within planetary boundaries and we're in deep trouble. So how we produce our food is very important. And Gary has certainly been a leader in soil sequestration and from both crop culture and animal culture. And we clearly need more emphasis on that to, again, document best practices, disseminate best practices, and provide incentives for farmers to move in that direction as well. Next slide, please. So just to summarize, feeding 10 billion people a healthy diet within safe planetary boundaries is possible and will improve the health and well-being of billions of people. This could allow us to pass on to our children a viable planet. So there is a pathway to a viable future, but it's not going to be easy, and it will take the involvement of almost everyone. So thank you. And I see a few questions and comments were coming up on the screen there, so maybe we can shift over to those.